Fibrinolytic factors and inhibitors, plasmin. This test may be ordered as euglobulin lysis time, plasmin level, or plasmin activity. The specimen is plasma. The method is chromogenic substrate. Fibrinolytic factors and inhibitors, alpha-2 antiplasmin. Plasminogen activator. This test may be ordered as plasminogen activator inhibitor, PI. The specimen is plasma. The method is chromogenic substrate or enzyme-linked immunosorbent assay. Fibrinolytic factors and inhibitors, plasminogen, except antigenic assay. Plasminogen, antigenic assay. This test may be ordered as plasminogen level, functional plasminogen, or plasminogen activity. The specimen is plasma. The method is chromogenic substrate. Heinz bodies, direct. Heinz bodies, induced, acetylphenylhydrazine. This test may be ordered as an induced Heinz body stain. The specimen is whole blood or finger stick in adults, or heel stick in infants. The method is phase microscopy or supravital stain, e.g., methyl violet, crystal violet, and brilliant crescel blue, new methylene blue. A blood sample is treated with a chemical, usually acetylphenylhydrazine, and a blood smear is prepared and examined for the presence of Heinz bodies in the red blood cells. Hemoglobin or RBCs, fetal, for feto-maternal hemorrhage, differential lysis, Kleihauer Betke. This test may be ordered as a Kleihauer Betke stain or KB stain, a Kleihauer Betke stain for fetal hemoglobin, a Kleihauer Betke stain for feto-maternal hemorrhage, acid-resistant fetal cells, or a differential lysis stain. The specimen is whole blood or finger stick. The method is semi-quantitative stain following acid elution. Hemoglobin or RBCs, fetal, for feto-maternal hemorrhage, rosette. This test may be ordered as a fetal hemoglobin screening test, a fetal red cell rosette, a fetal dex screen, or a fetal screen. The specimen is whole blood or finger stick. The blood is treated with a chemical, NTD, that causes fetal cells to form a rosette, or circle, of cells. This test is a screen usually performed on Rh-negative postpartum mothers to determine if the newborn bled during delivery. Hemolysin Acid. This test may be ordered as positive acidified serum test, or as a HAM test. The specimen is whole blood or finger stick in adults, or heel stick in infants. The method is manual. Heparin assay. This test may be ordered as a quantitative heparin analysis, or as a heparin level. The specimen is plasma. The method is chromogenic assay. Heparin neutralization. This test may be ordered as a heparin thrombin coagulation time test, or as protamine neutralization test. The specimen is plasma. The method is manual. Heparin protamine tolerance test. This test may be ordered as a heparin protamine tolerance test. Method is point-of-care testing. Iron stain, peripheral blood. This test may also be ordered as a Prussian blue stain, hemosiderin stain, or red cell iron stain. The specimen is blood stored unclotted. Method is slide preparation with Pearl's Prussian blue stain and visual microscopy. Leukocyte alkaline phosphatase with count. This test may be ordered as a leukocyte alkaline phosphatase test, LAP, lab score. The specimen is whole blood. The method is enzyme reaction with leukocyte alkaline phosphatase liberating naphthol, which is manually stained. Smears from freshly collected whole blood are prepared, stained, and examined microscopically. Mechanical Fragility Rbc. This test may be ordered as a red blood cell mechanical fragility test, or as a mechanical red cell fragility. The specimen is whole blood or finger stick in adults, or heel stick in infants. The method is manual. Muramidase. This test may be ordered as a muramidase test, a myelomonocytic lysozyme test, or as a malignant lymphoma lysozyme test. The specimen is serum, bone marrow aspirate or 24-hour urine specimen. The method is flow cytometry, gel diffusion assay, radioimmunoassay, or enzymatic. Osmotic fragility, Rbc, unincubated. Incubated. This test may be ordered as an osmotic fragility test, a red blood cell fragility, an uninucleated osmotic fragility, or as a red blood cell osmotic fragility. The specimen is whole blood. The method is manua. Platelet aggregation, in vitro, each agent. This test may be ordered as a platelet aggregation study, or as an in vitro platelet aggregation study. Specimen is plasma. The method may be platelet aggregometer. Phospholipid neutralization, platelet. Hexagonal phospholipid. The specimen is by venipuncture. Prothrombin time. This test may be ordered as a prothrombin time, PT, a prothrombin, or as simply PT. The specimen is plasma. Method is one stage using an automated device. Substitution, plasma fractions, each. This test may be ordered as a diluted prothrombin time, PT, a prothrombin 1:1, or as plasma diluted PT. Russell Viper venom time, includes venom, undiluted. Diluted. This test may be ordered as a Stipven time, Russell Viper venom time, or as an undiluted Russell Viper venom time. The specimen is plasma. Method is automated with a phospholipid being added to the test system to neutralize platelet activity. Reptilase Test. This test may be ordered as a reptilase test or, more commonly, reptilase time, RT. The specimen is plasma. Method involves adding venom of pit viper to a sample of the patient's plasma and recording the clotting time. Sedimentation rate, erythrocyte, non-automated. Automated. This test may be ordered as an erythrocyte sedimentation rate, ESR, a Westergren sedimentation rate, Wintrope sedimentation rate, or simply as a SED rate. The specimen is whole blood. The method is the Westergren tube. In 85,652, this test may be ordered as a zeta sedimentation rate or as a zeta SED rate. Specimen is whole blood. Method is centrifugation. This is an automated test. Sickling of RBC, reduction. This test may be ordered as a sickle cell metabisulfite test, a sickle cell reduction test, an erythrocyte, RBC, sickling test, or as an RBC reduction sickle cell test. Specimen is whole blood. The method is manual. Thrombin time, plasma. This test may be ordered as a thrombin time or as a TT. Thrombin time, titer. This test may be ordered as a thrombin time titer or as a diluted thrombin time. The specimen is plasma. The method is manual clotting. Thromboplastin inhibition, tissue. This test may be ordered as a tissue thromboplastin inhibition test, TTI, or as a lupus anticoagulant, LA, test. Extravascular tissue requires a biopsy. The method is manual clotting. Thromboplastin time, partial, PTT, plasma or whole blood. Substitution, plasma fractions, each. This test may be ordered as an activated partial thromboplastin time or APTT. The specimen is plasma. The method is automated coagulation instrument. In 85732, this test may be ordered as a APTT 1:1, or as a plasma-diluted PTT or APTT. Viscosity. This test may be ordered as a serum viscosity test or as a viscosity. Specimen is serum. Finger stick or heel stick is not acceptable. Method is viscometer.